at 10 and 10:30.
Okay.
And Senator Gray, I also have one at 9:45.
All right.
I think. If I can get there. All right.
We are all set, Senator Gray.
Okay, thank you very much. Welcome. I am Senator James Gray. Today we will be having public hearings on House Bills, House Bill 75 and House Bill 479. Before I get started, I will read through the checklist to ensure that the meeting we are holding is in compliance with the Right to Know law. As the acting chair of the Health and Human Services Municipal Affairs Committee, the Health and Human Services, I'm trying to read from both scripts here at the same time. I find that due to the state of the emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's executive order number 12, pursuant to executive order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that we are providing public access to the meeting by telephone, with additional access possible by video and other electronic means. We are utilizing Zoom webinar for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access to contemporaneously watch and listen to the meeting on Zoom and YouTube and via phone by following the directions and links provided on the general court website. We have provided public notice of the testimony of the necessary information for accessing the meeting in the Senate calendar. We are providing a mechanism for the public to alert the public body during the meeting if there is a problem with access. If anyone has a problem, please call remote Senate at leg.state.nh.us or call 603-271-6931. In the event the public is unable to access the meeting due to problems on our end, we will adjourn and reschedule. Please note that all votes taken during this meeting shall be done by roll call vote. Finally, let us start the meeting by taking a roll call attendance. When each member states their presence, please also state where you are and if anyone else is in the room with you during this meeting, which is required under the Right to Know law. Roll call. Senator Sherman?
Yes, this is Senator Tom Sherman. I am alone in the room, but my family is present and I'm in my home in Rye. My family is present in the house.
Senator Whitley?
Good morning, Senator Whitley, in my home in Hopkinton. I'm alone in the room, but my family's in the house.
Senator Avard?
Hi, this is Senator Kevin Avard. I'm in my office in Nashua, and there are a few people in the house and a barking dog.
Senator Bradley is at a conflicting meeting right now, and I am Senator Gray. I'm at my home in District 6 in Rochester, and I'm alone in this room. I would also like to welcome Amber Marintz, our interpreter. She will be here at least for the first bill. And with that, we'll call the first bill, House Bill 75. And I think I'm right with that. And we'll go from there. Who is the sponsor? And if you'd call them, I'd appreciate that.
Okay. It is Representative Pearson. Let me just have to wait until Kirsten is sharing the link there. Okay. Kirsten, I need the screen. Can you? Thank you. Okay. Representative Pearson, you should be all set to introduce your bill.
Thank you very much. Am I coming through?
Yes, you are.
My name is Mark Pearson. I represent Rockingham County District 34. I'm also chairman of the Health, Human Services, and Elderly Affairs Committee in the House. And more relevant to this bill, I am the chairman of the New Hampshire Commission on Deafness and Hearing Loss. This was a bipartisan bill last year. It passed committee unanimously, but died a COVID death in crossover. So we're back. And again, this is a bipartisan bill, and it came unanimously out of my committee and was adopted in a voice vote on the House floor. House Bill 75 seeks to do two things. Number one, rename the New Hampshire Commission on Deafness and Hearing Loss. Members of this commission and of the wider deaf and hard of hearing community would rather the name of the commission reflect people and not physical conditions. Naming us the Commission for the Deaf and Hard of Hearing not only focuses on people, but it brings the title into conformity with commission titles in most states. Secondly, part of our commission's work is to oversee the proper care of deaf and hard of hearing people in various places. One aspect of this care is for people in extended care facilities. Consultations with the present leaders of the three major extended care facility associations was very encouraging. They want to work with us, and we all concluded the best way to do this was by having representatives of these three groups come onto the commission itself. And this bill will enable bringing these three people to happen. So that is my testimony. That is what the bill is about.
Thank you, Representative. Senator Sherman, you have a question.
Thank you, Mr. Chair. Good morning, Representative. Great to see you, or hear you at least. On the membership, I've been in touch with Lisa Henderson from Living Age, and they represent, as you are aware, they are actually the fourth major association in the state. And many of their communities are CCRCs. So I'm wondering if you would be open to a friendly amendment that would allow an additional appointee from Leading Age to make sure that we capture all the different populations.
Senator Sherman, it's good to see you, and I'm always welcoming of a friendly amendment. I was not aware of this. I apologize for that. And this amendment you suggest would enrich us and the work we do. So yes, please.
Thank you.
Additional questions? Okay, thank you very much, Representative.
Thank you, Senator Gray.
Do we have questions, or the list that I have doesn't have any additional speakers? I don't know if the real list does.
It does not. If there is anybody that would like to speak to this bill, could you please virtually raise your hand? And if you are on the phone, you can dial *9 to do that. Okay, I do not see any hands. Senator Gray?
Okay, we probably would have time to go into executive session, but I believe that the chair would like to attend that. But we also have two senators who will be leaving us to go present bills in other committees. So if we all can get back today, I think that we can exec this one when we're all together. But we'll try to get everyone here to be able to vote on that. Senator Sherman.
Do you want me to work on wording of a possible committee amendment for that exec session for that one addition?
If we're only adding that particular group and we know the name of the group, I'm sure that a committee amendment could be done. If you would like to do it more formally with a formal amendment, I'm also open to that. But again, the amendment will get written, whether it's a committee amendment or, if you guys pass it, it'll happen. So.
Okay, I just wanted to be sure I was doing what you would like me to do to prepare for the exec session.
All right. And I'm making decisions for Senator Bradley, so, I'll continue to do that, and we'll postpone going into executive session at least till he gets here. All right, close the hearing on House Bill 75, and we have approximately 3 to 4 minutes before the time for the next meeting. I want to thank our interpreter for helping us out with this, and appreciate that. And I'll see you back in a few minutes. Amber, if you're going to stay around, that's fine. But the next thing we will do is take up the next bill, and that will be in about 2 or 3 minutes.
I think I'm supposed to go, but I'm not. Kirsten?
Yes, we just scheduled you for HB 75, so you're free to go from here.
Thank you so much, everyone. I appreciate it.
Thank you.
Take care now.
We're getting close here. So
Jim, I'm going to be testifying very shortly.
All right, Kevin, I will talk to you in a few minutes.
Oh, I have you muted. Hang on. Yeah, I'm going to be testifying very shortly. So I'll see you in a minute.
Okay. I have 9:45. So we'll open up the hearing on House Bill 479 relative to pharmacist provider status, nicotine cessation therapy. And welcome the prime sponsor. I guess it's Representative
Merchant, you should be all set.
Okay.
I am. Thank you, Chairman. Chairman Gray, members of the Senate Health and Human Services Committee, and members of the public. For the record, I'm Representative Gary Merchant, representing the residents of Sullivan County, District 4, Claremont, Ward 2. I'm also a member of the House Health and Human Services and Elderly Affairs Committee. The bill before you came out of the committee with unanimous support. It was supported with ought to pass. It was placed on the consent calendar, and on a voice vote was passed by the full House. The bill before you, House Bill 479, actually has two components to it. One is recognition of pharmacists as healthcare providers, the other, and also the bill for Medicaid for the services within the scope of practice. Inclusion of nicotine cessation therapy is the expansion of the scope of practice. I did submit written testimony to you folks today or before, and I don't, unless you want me to read it, I'd prefer not to. So I try to avoid that. But basically,
I did receive your testimony as well. I'm sure the rest of the committee did. So if summarization is the thing, I would prefer that.
All right. Thank you, Mr. Chairman. In summary, basically, the CMS reimbursement to New Hampshire for services performed by a healthcare provider requires that the state recognize the individual as a healthcare provider in state statute. Because the state does not recognize the pharmacist as a healthcare provider in the state statute, CMS will therefore not reimburse New Hampshire Medicaid for such services, which House Bill 479 corrects. Smoking is a public health epidemic and the single largest cause of preventable disease and death. According to the 2020 U.S. Surgeon General report, smoking cessation intervention should be implemented as widely as possible throughout the healthcare system, as pharmacists providing smoking cessation therapy. House Bill 479 not only supports the improvement of health for our constituents here in New Hampshire, it also supports the U.S. Surgeon General's call to implement interventions as widely as possible throughout the healthcare system here in Granite State, and trying to minimize preventable death, if you will, in disease according to smoking. So fundamentally, there's two parts to it. One is to recognize pharmacists as healthcare providers so that New Hampshire Medicaid can bill for the service and get reimbursed partially from the federal government. And number two is allow pharmacists to provide smoking cessation therapy to patients. And we all know, for the most part, they go into pharmacies routinely, and having the access and opening up access as much as we possibly can so that they can get the therapy they need to stop smoking. I'll open up for questions.
All right. Okay. Senator Whitley.
Thank you, Mr. Chair, and thank you, Representative Merchant, for taking my question. I'm wondering if you had information that you could share with the committee about how many other states have requested the state plan amendment contemplated in this bill.
Right now, there's approximately, the last I know, about 5 or 6 states that have such a plan. It does require modification of the state plan. We have done that because of COVID-19 to recognize pharmacists with billing for COVID vaccine, but it's very limited to that one issue, which is COVID vaccinations, and not looking at it generally speaking. So once the emergency order goes away, which is the PrEP Act and so forth, that will all dissipate.
Thank you.
I don't see any additional questions. Thank you very much, Representative. Do we have, I think there's 2 people on my list. I don't know if either of them are here on the call.
Yes, we have Tanya Carlton. You are all set to speak. Go ahead.
Good morning, Chairman Gray and members of the Committee of the Health and Human Services Committee. My name is Tanya Carlton. I'm the Clinical Pharmacy Manager at Wentworth Douglas Hospital in Dover, New Hampshire, as well as the immediate past president of the New Hampshire Society of Health Systems Pharmacists. So I'm testifying today in support of HB 479 and its goal of increasing patient access to nicotine cessation, as well as pharmacist provided services. So briefly, as I believe you did receive my testimony as well, I'll just briefly summarize. Currently at Wentworth Douglas, we do have 3 pharmacists that work in the ambulatory care setting in oncology, cardiology, and internal medicine. As part of their role, it's very important to counsel patients and treat patients for smoking cessation, especially in these areas in which they can increase they can help those motivated to quit smoking succeed in this difficult endeavor, and potentially, decrease morbidity and mortality in the areas in which they are actually practicing. As I stated, you did receive my testimony, but I did just want to speak up and speak in favor of this bill.
Thank you very much. Senator Sherman.
Thank you, Mr. Chair. One of the things I see in this bill, and I'm sorry I wasn't quick enough to get Representative Merchant, but is that we have been moving as a legislative body towards recognizing the function of physician assistants in ordering services. And in this bill, it limits the orders to nurse practitioners and physicians. I'm wondering if Tanya has any concern or would object to including physician assistants in that capacity to order, since we are, more and more moving towards mid-level providers being able to write the orders that would allow this kind of intervention.
We would certainly want to work with the physician assistants as well. So I think we had limited it to the physicians and nurse practitioners based upon what they are currently able to do. But if the physician assistants are also able to write those orders, we would want to be working with them as well.
Okay. Tricia, if Representative Merchant is still here,
Yes.
could you promote him also so that Senator Sherman would have an opportunity to get his input on that question also?
Thank you, Mr. Chair, and also thank you, Senator Sherman, for that question. What I don't know, and I think we need to research, is whether a physician assistant has independent prescribing. My understanding is their authority to prescribe is under the physician, and whether they can delegate that authority beyond themselves, because it flows from the physician, not per se from the physician assistant. So therefore, I don't know whether they can redelegate that authority to a pharmacist.
Yeah, that's a great question, and I'm happy to do that work. But I just wanted to make sure that if that is the case, you would not have any objection to including them. As the acting chair knows, we've spent the last 3 years, actually longer than that, bringing physician assistants up to being able to work in the fields of psychiatry, being able to do post and end of life orders. And you're correct that they are under the, that they work under a physician, but they are, as you know, able to prescribe broadly and write orders. So but that's a great point, and I'll certainly do that legwork. Thanks.
Ms. Carlton, did you have a comment on that, Ms. Carlton? I didn't know if the other testimony prompted something from you.
I did not have any further comments.
Okay, Representative, it seems like I cut you off there.
I just wanted to say thank you, Senator Sherman. I totally support a physician assistant being able to do that as long as they can do it legally, which we discussed.
All right. Good. Additional questions? Okay, thank you very much. And
Okay.
I've got at least one more on my list.
Yes, we do. Okay. We have Bob Terrio. Mr. Terrio, you should be all set.
Good morning. Thank you, Chairman Gray and members of the committee. My name is Bob Terrio. I'm the Director of Pharmacy at Wentworth Douglas Hospital, and I'm currently the Legislative Chair for the New Hampshire Society of Health Systems Pharmacists. And I'm speaking in support of House Bill 479. At Wentworth Douglas, I did submit written testimony too, so I hope you did that. And as part of the testimony, I included a CMS guidance document that includes some information about collaborative practices and this relationship of using smoking cessation. But at Wentworth Douglas, we, as Tanya noted, we have pharmacists that have collaborative practice agreements in primary care in our cancer center, and in cardiology. And in those settings, they practice just like a provider. They get referrals, they see patients, they have appointments, and per their CPA, they're able to modify and work with drug therapy issues. We do work with physician's assistants too, typically under the auspices of that provider. In those areas, it's interesting. Yesterday, we're trying to expand our services in primary care, and I was meeting with family practice, and they asked me how we're going to pay for these expanded services. And my comment was, we really pay for the pharmacist services today by freeing up the doctors so that they can see more acute care and through quality assurance measurements. Right now, pharmacists do not get reimbursed for their services unless we do an incident to providers. So this will open an opportunity for pharmacists to get reimbursed in this area. And if you look at the areas that we're also involved, cancer, primary care, and cardiology, these are areas where smoking is high. And as pharmacists are meeting with their patients, if they have an opportunity or they've decided they want to quit at this time, this bill would allow the pharmacists, without having to revise their CPA, to intervene and work with the patient on providing smoking cessation. So I'm in support of House Bill 479, and I welcome any questions or comments that you have.
Additional questions from the committee? All right. Seeing none, thank you very much.
Thank you.
Okay, is there anybody else that would like to speak to this bill? Please virtually raise your hand or dial *9 if you are on the phone.
Mr. Chair, I'm going to have to go over to the House hearing. Thank you.
All right. Thank you, Senator.
And I do not see any other hands, so.
All right.
Back, Mr. Chair.
Thank you. With that, we will close the hearing on House Bill 479. Senator Bradley did say that he was going to be back at 10. So I was trying to look up the spreadsheet for our bills. I think we've got all the Senate bills taken care of. Is that right, Trish?
No, we do have a couple Senate bills left.
Pearson, excuse me.
That's okay. We still have 29, 74, and 121, and I believe 140 as well.
All right, so it does appear that we're going to need to go into executive session, but we will take a break until 5 after 10 to try to get Senator Bradley back, and then maybe Senator Sherman's bill will go quickly and we can get him back too. So we'll be in recess till 5 after. Kirsten?
Yes.
Senator Bradley has returned.
All right.
And I think as soon as Senator Bradley unmutes himself, I think we're ready to come out of recess. To bring you up to speed, Senator, we did have the hearing on the two bills. Both of them require a small amount of work. The first one could be done with a committee amendment, but the second one I think needs a little extra time. And Senator Sherman right now is presenting a bill in a different hearing.
Okay. So how long, Jim, is Senator Sherman likely to be occupied?
Since I don't believe it's the first bill, and you know how those hearings can stretch out, I really can't answer that.
Do we want to recess to a time certain, say 11 o'clock, or do we want to just, I know the biggest bill that we have to do today is, I think it's Senate Bill 75, which is Tom's bill.
74, yeah.
74. So
Senator Whitley, Senator Avard, you should weigh in on this too.
Yeah, I think we should wait till Senator Sherman comes back if we need to vote on his bill.
11's fine.
is everybody okay with 11?
Yep.
All right. And we are live, so for the public, and I apologize for having to turn everything over to Jim yet again. We will be in recess until 11, and we will come back at 11 for purposes of executing bills.
And Kristen, if you get a hold of Senator Sherman, we'd appreciate it.
I'll text him too.
Okay.
Thanks, Jim. Thanks, everybody.
Thank you.
Those were awful noisy papers, Senator Bradley.
Are they? Did you get your bill introduced, Tom? Good. And Kevin's back, so I think Kirsten.
Yes, I'm here.
Okay. So we're just waiting on Kevin to turn on his camera.
It was 2 bills, so it was good.
Kevin, can you hear us?
I can.
There you go. All right. The time being 11 o'clock, the Health and Human Services Committee is out of recess. Thanks again to Jim for conducting the hearings this morning. Can I have a motion to go into executive session?
Move to go into executive session.
Second.
Moved by Senator Gray, seconded by Senator Sherman. Let's call the roll. Senator Whitley,
Yes.
Senator Sherman,
Yes.
Senator Avard,
Yes.
Senator Gray,
Yes.
and I vote yes. Okay. So what I'd propose today is that we do the 3 Senate bills that we still have, given that it's our deadline. So why don't we start with Senate Bill 74, Senator Sherman's bill. I think Senator Sherman for a motion.
I move ought to, let's see, we've got the amendment. So I move ought to pass as amended and introduce the amendment. Is that the correct order?
Yep.
Second that.
Okay. The amendment's been supplied to people. It's in the OneDrive. Everybody should have had a chance to review it. I think it was gone through in detail last week with questions asked of folks. So is there anybody that has any further questions, either of Senator Sherman or Ms. Minahan, or who is the other person, Tom, you were working with primarily?
Oh, Kate Hannah.
Kate
I'm
Hannah,
not sure
yes.
she's on the call. I think
Okay.
Paula is probably
Paula
the best.
probably is, yeah. But are there any questions, or are we prepared to vote on the amendment? Okay, I don't see any questions. So we're voting on amendment, if I could have the number again.
It is 0854S.
So we're voting on amendment 854. And seeing no further questions or discussion, we'll call the roll. Senator Gray.
Yes.
Senator Sherman.
Yes.
Senator Whitley.
Yes.
Senator Avard.
Yes.
And I vote yes. All right. So Senator Sherman moves ought to pass as amended, seconded by Senator Whitley. Any further discussion? Seeing none, I'll call the roll again. Senator Gray.
Yes.
Senator Sherman.
Yes.
Senator Whitley.
Yes.
Senator Avard.
Yes.
And I vote yes too.
Consent
so
or no?
I don't think this is a great idea to put it on consent with such a big amendment. If there are any questions, we just have to get pulled off. Is
Okay.
everybody all right with
Can I
that?
take it out?
Yes, you may.
May I take it out? Thank you.
Not only may you, but you can take it out. Okay.
The grammar police.
The grammar police. Well, you started it. Okay, so we still have Senate Bill 29, and I believe it's 121. Why don't we go in reverse order and do 121 first? That's Senator Rosenwald's bill about a state-based exchange. We did get a pretty comprehensive initial report from the Department of Insurance. I asked Kirsten to put it to make sure everybody received it a couple of days ago. I'm not sure I fully understand all the implications of it, but in the conversations that we've had with the department, I think my sense is a re-refer motion at this point would still be the best option. The rewards seem to have diminished somewhat, but I am hearing that the Biden administration is considering putting back navigators and those types of things back into the federal health-based exchange. So the percentage now is slated to be 2.25%, which means less savings for the state, but it could go back up with some of the changes that are being contemplated again. So that's one reason for, I think, further looking at it to better understand both the costs and the benefits and the liabilities that we would have. So that's my view on it. Anybody else? Jim?
Move re-refer.
Second.
Tom, you had your hand up.
Yeah, I'm fine with re-refer. I just point out that I believe this is enabling rather than directing.
It is enabling, especially the way it's written. Just the one cautionary note I would have is that when the Affordable Care Act was passed, there was a lot of discussion about legislative involvement in the discretionary items that New Hampshire had at the time and defining the essential health benefits and things like that. I suspect that our colleagues would want to be involved. Whoops, did I just get lost?
You're still
You're
there.
still there.
I'm still here. Oh, it's gone from my computer screen. Sorry. That our colleagues would want to be very involved in. So that's
Right.
why I think
I'm-
re-refer is a better option.
Yeah, I'm fine with as I said, I'm fine with re-refer. I just wanted to point that out.
Okay,
And,
Senator
you know,
Whitley.
Yep, thank you. And Senator Rosenwald, I think, is okay with this as long as, you know, we are all committed to continue to work on this, which I think we are.
My view is if the rewards are good enough to, knowing that there are going to be additional obligations, even though this is somewhat off the shelf at this point for both the health and insurance departments, that is a reason to be able to move forward with it. And having more state-centric, terms and conditions, I suppose, is another good reason. So in any case, Senator Gray.
My reason for re-refer is line 7 through practically down to the bottom. And it gives the authority to the department to go and do this without any additional work from the legislature or anything. And so those are kind of the words that I would like to see modified in this to make sure that once we've looked into this, is that the department is not solely on its own to go out and implement this. So that's something that can be worked and re-refer.
Okay. So Senator Gray made the motion. It was seconded by Senator Sherman for re-refer. I'll call the roll. Senator Avard.
Yes.
Senator Whitley.
Yes.
Senator Sherman.
Yes.
Senator Gray.
Yes.
And I vote yes.
Mr. Chair.
Yes.
I think it was Senator Avard who did the second, but if not, I'm happy to take credit.
Yeah, I think you're right. I think you're right.
I'm
Pearson, did you get that? Senator Avard made the seconding motion for re-refer. Okay.
Move consent.
Senator Gray has moved consent. Is there a second? Senator Sherman seconds. Senator Sherman.
Yes.
Senator Whitley.
Yes.
Senator Avard.
Yes.
Senator Gray,
Yes.
and I vote yes on that. Okay, our last bill is Senator Gaida's bill.
You need it. Who takes it out?
Oh, I'm sorry. Senator Avard can take that one out. Okay, Senate Bill 29. My understanding is the advisory commission, is Mike Holt on the attendee list by any chance?
He is, yes, I can bring
Yeah,
him
why
in.
don't we bring him in and then I'm not repeating incorrect. Good morning, Mike. Mike, can you hear us? And if you can, if you could unmute yourself.
He may not be there if he wasn't prepared to speak.
Okay, well, let me start. If he chimes in later, that'd be good. My understanding is, and I believe that at least I hope I forwarded the communication that I received from Representative Knirk, who chairs the advisory commission. They voted against recommending Senator Gaida's bill. Senator Gaida has indicated to me that he would like to work with the folks on the advisory commission and refile a bill. And so
hello, this is Mike. Michael Holt.
There we
yes.
go. Hi, Mike. Good morning. How are you?
Yeah, I'm logging on right now.
Okay, we hear you. Could you maybe outline
I'm
what?
gonna hang up. Hello,
what-
sorry, Michael Holt. I was just on the phone with my legislative liaison. How can I help?
If you could just outline for us, Mike, what the advisory group led by Representative Knirk voted for recently with regard to Senator Gaida's bill, Senate Bill 29.
Yes, thank you. So for the record, my name is Michael Holt. I'm the administrator for the Therapeutic Cannabis Program. Senator Gaida's bill, Senate Bill 29, would have set a threshold limit on potency of THC for patients under age 21. The board, Senator Gaida presented this bill to the board at their February meeting, and a discussion ensued, and then the board took it up and voted on it at their March meeting. Senator Gaida did not provide an amendment based on testimony that was heard at the public hearing or discussions, so the board's vote was on the bill as introduced. They agreed with the concern that high potency products in adolescence was an issue to be addressed. However, they recommended a vote to ITL this bill based on it being essentially unworkable in its form, and based on the passage of another bill, House Bill 163, which would require specific educational and counseling requirements for this population, including the risks of high potency cannabis. So they felt that it was redundant with a better bill, a more workable bill in the form of House Bill 163. So that's the high level, and it was a unanimous vote of the Therapeutic Cannabis Medical Oversight Board to recommend ITL of this bill.
Okay. Are there questions of Mr. Holt? Senator Sherman.
Yeah, just a quick one. Hi, Mike. One of the pieces of testimony was that we all know the cost of these products is very high, and parents who understand the potency and the issues with that will, to make it affordable, they will buy the high potency version and then dilute it, for lack of a better term, dilute it to a point where it is appropriate both therapeutically and to avoid any side effects. Did that come up at your hearing? Because I thought that was one of the sort of unintended consequences of putting this restriction on, was that it would potentially price these products out of some families' available means.
Yes, thank you for the question, Senator Sherman. That issue did come up in testimony that the board heard, and they did consider that as a factor.
Thank you.
Other issues were that the bill brings this closer to a prescription for cannabis. You know, having a doctor say that a potency of greater than 10% brings it closer, further away from a certification of a qualifying condition and closer to you need X amount of cannabis to relieve your symptoms, increasing the liability of certain providers in order to do that. The fear is that providers would choose not to sign on the dotted line, so to speak, a higher potency out of liability concerns. Those patients would then not be able to access those products, and those patients would then be forced into a black or gray market in order to get those products. So that was another concern raised. And another was just the simple fact that most of the products that are available would become unavailable. You know, the ATCs would need to reformulate many of their products to bring them under a 10% threshold. And the other robust discussion was the difference between potency and dose, and how they interact, and the lack of real scientific evidence to establish a threshold amount. 10% is arbitrary, 15% is arbitrary, 5% is arbitrary. There's no medical evidence to support a specific number over which a threshold amount would be appropriate. And so again, they really felt that House Bill 163, which has a requirement for certifying providers to explain the risks of therapeutic use of cannabis to the adolescent population under 25. Note that Senate Bill 29 would only require this for 21 and younger, but House Bill 163 would require it for the full range of adolescents up to and including age 25. That bill also has a documentation requirement that HHS needs to put in place to document that counseling has taken place. They thought that was the best place for this very legitimate concern that Senator Gaida is bringing up, rather than the bill as proposed.
Great, thanks.
So my guess is that House Bill 163 will be assigned to our committee. So I think, just in my view, a motion of ITL is fine. Senator Gaida can, he may move to table it when it gets to the floor, or I'm sure he can reintroduce a different bill next year after working with Mike and others.
I'll second that.
So Senator Whitley has actually moved
Oh, okay.
ITL.
That's fine.
And
I'll move
I gave my
ITL.
opinion. You get to make the motion.
That's fine. I'll move ITL on SB 29. I do think we have another vehicle to continue this conversation, and it sounds like the vehicle that most people want to work on.
Okay. And Senator Gray is seconding, I assume?
Yes.
Okay. Any further discussion? Seeing none. Senator Whitley.
Yes.
Senator Gray.
Yes.
Senator Avard.
Yes.
Senator Sherman.
Yes.
And I vote yes too. We could put this on consent, but if Senator Gaida decides he wants to table it, we just have to take it off consent. So Why don't we just leave it on the regular calendar?
I would move consent, because if he's not going to pull it off the table, it then.
Okay,
It's
fine.
fine.
I'll second that.
Overruled. All right, Senator Sherman has moved consent, seconded by Senator Whitley. Okay, Senator Sherman first.
Yeah. Yes.
Senator Whitley,
Yes.
Senator Avard,
Yeah.
Senator Gray,
Yes.
and I'll vote yes too. Okay. That,
Who's going to take it out?
Senator Whitley gets this one.
Thanks.
Okay, so do we have a motion to come out of exec session?
So moved.
Senator Bradley,
Yes.
you may want to take up Senate Bill 75. The only thing that we got was to add one more group to that, and that was the leading age group.
I think
so
you
that
mean
could be done
House
with
Bill
a committee
75?
amendment. House Bill 75, the first
Bill.
one that we heard today.
Okay, all right.
That would show our strong support and get it right on to the Senate calendar.
Everybody all right with that?
Yep.
All right, so Senator Gray has moved a committee amendment to House Bill 75. And Kirsten, do you know what that group is and you can take care of the amendment?
I understand what you were speaking about, but if you have specific language that you would like to have me use, I would prefer.
It's the exact, if I can jump in.
Go ahead.
It's the exact same language as in those other ones, but the organization is called Leading Age. It's one word, capital L, capital A.
And I'll second.
Okay, so
And
The
Kirsten,
amendment
if
is
you
a
have
committee-
any trouble with that, let me know and I'll help you.
the
Thank you.
committee amendment is to add another group to the groups on the commission called Leading Age. We'll call the roll. Senator Gray,
Yes.
Senator Avard,
Yes.
Senator Whitley,
Yes.
Senator Sherman,
Yes.
and I vote yes. Okay. Senator Gray has moved ought to pass as amended, seconded by
Senator Avard.
Senator Avard. Senator Whitley,
Yes.
Senator Sherman,
Yes.
Senator Avard,
Yes.
Senator Gray,
Yes.
and I'll vote yes.
Move
Uh,
consent.
Senator Bradley. Oh, I'm sorry.
Yeah. Go ahead, Senator Sherman.
I have the actual language from Lisa Henderson from Leading Age, which I will send on to
Okay. All right.
Kirsten.
Okay, thank you.
Second.
So it's been moved by Senator Gray for consent, seconded by Senator Avard. We'll start the roll. Senator Gray,
Yes.
Senator Avard,
Yes.
Senator Sherman,
Yes.
Senator Whitley,
Yes.
and I vote yes.
I'll be happy
Okay.
to take it out if that's doable.
Okay. Very good. All right, now a motion to come out of exec session.
So moved.
Second.
Moved by Senator Avard, seconded by Senator Gray, Senator Whitley,
Yes.
Senator Sherman,
Yes.
Senator Avard,
Yes.
Senator Gray,
Yes.
I vote yes. And a motion to adjourn.
So moved.
So move.
So moved by Senator Avard, seconded by Senator Gray. Senator Avard,
Yes.
Senator Sherman,
Yes.
Senator Whitley,
Yes.
Senator Gray,
Yes.
and I vote yes. Okay. See you all next week.